Hello, everyone, and a heartfelt welcome. In this video lecture, we'll delve into the intricacies of reality therapy in the realm of counseling. Let us try to understand what is the reality therapy in counseling. Reality therapy, developed by psychiatrist William Glasser, is a counseling approach that focuses on personal responsibility, choice, and the development of effective strategies for meeting one's psychological needs. This therapeutic model is grounded in the belief that individuals have the power to make choices and take control of their lives, regardless of external circumstances. Reality therapy is often used to help individuals gain insight into their own behaviors, make more effective choices, and improve the quality of their relationships. Key principles of reality therapy. 1. Choice theory. At the core of reality therapy is choice theory, which posits that individuals are motivated by their innate needs for love and belonging, connection and relationships with others. Power, the ability to achieve goals and have an impact. Freedom, independence and autonomy. Fun, enjoyment and satisfaction. 2. Focus on the present. Reality therapy emphasizes the present and what individuals can do in the current moment to create positive change. The past is acknowledged, but the emphasis is on what can be done now and in the future. 3. Personal responsibility. Individuals are encouraged to take responsibility for their choices and actions. This includes acknowledging personal responsibility for meeting their own needs and making choices that align with their goals. 4. No excuses, no blame. Reality therapy rejects excuses, blaming others, and external circumstances as reasons for one's unhappiness or lack of progress. Instead, individuals are empowered to focus on what they can control and change. 5. Quality world. The concept of the quality world refers to an individual's personal ideal or vision of what a satisfying and fulfilling life looks like. The counselor works with the client to explore and clarify their quality world and help them make choices that align with it. Techniques used in reality therapy. 1. WDEP system. The WDEP system is a problem-solving method used in reality therapy, focusing on 4 key components. Wants, identifying what the client wants. Doing, exploring current behaviors and actions. Evaluation, assessing whether current behaviors are effective in achieving wants. Planning, developing a plan for more effective behaviors. 2. Contracting. A crucial element of reality therapy is the creation of a contract between the counselor and the client. The contract outlines specific, achievable goals and the steps the client will take to achieve them. 3. Reality therapy questioning. The counselor uses specific questions to prompt self-reflection and encourage clients to explore their choices and behaviors. Examples include, what do you want? What are you doing to get what you want? Is what you're doing working for you? 4. Role-playing. Role-playing is often employed to help clients practice new, more effective behaviors in a safe and supportive environment. This technique allows individuals to gain confidence in making positive choices. 5. Evaluating and adjusting plans. Regular evaluation of the effectiveness of the client's chosen behaviors is crucial. If the chosen actions are not leading to the desired outcomes, the plan is adjusted collaboratively between the counselor and the client. Application of reality therapy in counseling. 1. Relationship issues. Reality therapy is effective in addressing relationship challenges by helping individuals identify and modify behaviors that contribute to conflicts. Clients learn to take personal responsibility for their role in relationships and make choices that enhance connection and communication. 2. Addiction and substance abuse. Individuals struggling with addiction can benefit from reality therapy by acknowledging personal responsibility for their choices and developing alternative behaviors that align with their needs for love and belonging. 3. School counseling. Reality therapy is often used in school settings to address behavioral issues among students. It focuses on helping students understand the consequences of their actions and make positive choices to meet their needs for power and belonging. 4. Workplace issues. In workplace counseling, reality therapy can be applied to address interpersonal conflicts, improve communication, and help employees make choices that contribute to a more positive work environment. 5. Personal growth. Reality therapy is suitable for individuals seeking personal growth and self-improvement. By focusing on making effective choices aligned with personal goals, clients can work towards creating a more satisfying and fulfilling life. Strengths and criticisms of reality therapy. Strengths. Empowerment. Reality therapy empowers individuals to take control of their lives and make choices that lead to greater satisfaction. Practical approach. The emphasis on actionable steps and the present moment makes reality therapy a practical and goal-oriented approach. Versatility. It can be applied across various settings, including individual counseling, couples therapy, and group therapy. Criticisms. Simplicity. Critics argue that reality therapy may oversimplify complex psychological issues by emphasizing personal responsibility and choice. Cultural considerations. The individualistic focus of reality therapy may not fully address cultural variations in the perception of personal responsibility and choice. Limited emphasis on emotions. Some argue that the approach may not adequately address deep emotional issues. Thank you everyone. If you're passionate about education and teacher training, consider subscribing to my YouTube channel, Education and Teacher Education, at Shokeen Bilal.